Hello and welcome back to Natural Health Fix. On this video we're going to discuss all natural ways to treat and get rid of sciatica nerve pain completely. You might not even want to get up off the couch due to the severe and incapacitating nature of sciatic nerve pain. With a lifetime incidence of 10 to 40%, this condition is rather common, and you probably know more than one person who has experienced it. Your lower back is where the sciatic nerve originates, and it travels through your hips, buttocks, and down each of your legs. In the affected limb, sciatic pain typically travels along the course of the sciatic nerve. It occurs if a neuron along this pathway is compressed or becomes inflamed or irritated. A ruptured disc, spinal stenosis, a narrowing of the spinal canal, or injury are common causes of sciatica nerve pain. Additionally, piriformis syndrome, a medical ailment, can also cause sciatica. The piriformis muscle runs the length of your back, from the edge of your buttocks to the top of your thigh. The sciatic nerve, which is close by, can occasionally become trapped when this muscle spasms, and this can result in sciatic nerve pain. The first step in resolving the issue is figuring out what is immobile. The lower back and hips are frequently the body areas that cause the most issues. The majority of sciatica pain can be reduced most effectively, according to certified strength and conditioning specialists, by performing any stretch that can externally rotate the hip to provide some relief. It's important to determine what is initially damaging the nerve architecture while treating sciatica, so consulting a specialist is recommended. When treating severe sciatic nerve pain, some doctors opt to utilize pharmaceuticals like anti-inflammatory agents, muscle relaxants, or steroids. However, there is compelling evidence that stretching, physical therapy, and chiropractic adjustments can all significantly improve a patient's condition without harmful pharmaceuticals. Here are 6 natural remedies plus one very powerful vitamin-like antioxidant to help eliminate sciatica nerve pain. Number 1. Avoid sitting for long periods. When it comes to bulging discs and back discomfort, spending a lot of time sitting down, such as when working at a desk or watching TV during downtime, might make things worse. More movement is recommended as part of many treatment strategies for sciatica, coupled with specific exercises to loosen up tense regions. Stretching in particular ways or doing light isometric exercises throughout the day helps strengthen your body and reduce back and leg pain. You can perform specific stretches and exercises at home without needing to see a doctor when your symptoms reappear or get worse. Number 2. Reduce inflammation. Although it's thought that 5 to 10% of people with low back pain also have sciatica, there are a few personal and work-related risk factors that can increase the likelihood of getting sciatica. These include being tall, being elderly, experiencing a lot of mental stress, or being overweight. Also, spending a lot of time sitting down, smoking, and being exposed to a lot of vibration from moving automobiles. Numerous of these risk factors result in inflammation, which hinders wound healing and heightens pain. Eat a healing diet rich in nutrients, abstain from smoking and using recreational drugs, get plenty of exercise, and get enough sleep to reduce inflammation and increase your chances of experiencing sciatic nerve relief more rapidly. Number 3. Chiropractor adjustments. There are various types of herniated or ruptured discs. Some are more painful to the nerves than others. Because the disc's exterior layer is still intact, prolapse disc bulges are less severe than extrusion or sequestration disc bulges, which are more severe and typically more painful. These types harm the spinal disc's outer layer, causing tissue to leak out of places where it is typically restrained. As the issue worsens, disc tissue may invade the spinal canal while spinal tissue may completely separate from the disc. In a study that was published in the Official Journal of the North American Spinal Society, researchers compared the results of 102 adults with sciatic nerve pain. They found that those who received chiropractic adjustments had lower local pain, fewer days of pain, and fewer cases of moderate or severe pain than those who didn't. Number 4. Acupuncture and massage therapy. The goal of acupuncture, a sort of traditional Chinese medicine, is to improve or preserve health by allowing the body's natural energy flow to flow more freely. It targets particular bodily pathways using small, nearly painless needles. It has received FDA approval as a back pain medication and is backed by numerous studies for reducing chronic pain of all kinds, including sciatica. Similarly, rolfing and massage therapy are two more holistic, non-surgical methods that help open the body's muscles, tissues, and energy pathways, enhancing blood flow and reducing pain. Muscle relaxation, and even a healthy release of endorphins, natural, feel-good chemicals that function as painkillers, can aid in sciatica pain relief. Number 5. Use heating pads. By placing heating pads on the lower back for 15 to 20 minutes each day, on moderate or medium heat, many people can experience relief from sciatica. This can be worked on numerous times a day, roughly every 2 or 3 hours, at work or at home. The easiest option to relieve pain is to buy a reusable heating pad that either needs hot water or to be plugged in. However, you can also buy single-use heat wraps that last for a number of hours. While heat can be used to lessen discomfort, some people find that the contrary is as effective. Some people get relief by placing an ice pack on their back for 10 to 15 minutes every 2 to 3 hours. Number 6. Stretching. While some movements can make sciatica pain worse, some may actually make it better. For some people, discomfort is worsened by prolonged sitting, prolonged standing, and sudden movements. Scrunching or shortening of the spine occurs during certain motions, such as squatting, elevating the legs high, or bringing the knees to the chest. On the other hand, lengthening the spine through stretching or lying down can greatly reduce stiffness, irritation, and pain while also assisting in the development of excellent posture. Stretching is safe and helpful for persons with sciatic nerve discomfort, according to studies. Some of the most significant exercises for preventing sciatic pain concentrate on the back, strengthening weak areas and loosening tense ones. Even in rehab settings for sciatic nerve patients after surgery, exercises to avoid lower back discomfort and strengthen the core are performed. 7. Alpha-lipoic acid. An antioxidant known as alpha-lipoic acid is produced naturally by the body and can be vital for sciatica nerve relief. It is used to digest carbs and produce energy. Found in small amounts in foods including red meat, carrots, beets, spinach, and broccoli. Several studies have demonstrated the neuroprotective benefits of ALA in the central and peripheral nervous systems of rats. Numerous randomized clinical trials have also showed that ALA can safely reduce the signs and symptoms of carpal tunnel syndrome, diabetic neuropathy, and sciatica. For sciatica, pain from compressed nerve, it is recommended to take 600 milligrams of alpha-lipoic acid by mouth daily for 60 days. Don't forget to subscribe to our channel Natural Health Fix for more informative wellness videos as we journey towards a healthier you. See you on the next one.